I want to do a quick little Q&A about the Nexplanon and the symptoms I had with it, as well as the removal process, like how did it go, and just cover all of that in this video. So the first thing I want to talk about is the removal. Was it painful? I will say it was uncomfortable, but not super painful. I had expected it to be much, much worse. So what they're gonna do is they're gonna inject you with lidocaine, and that's honestly the worst part. It feels like a bee sting. You take a big deep breath in, and you let your breath out slowly, and by the time that your breath is let out, it's done. And it's really not that bad at all. Once they inject you with the lidocaine, it takes a few minutes for your arm to become numb, and then they're gonna use a scalpel. They're gonna pull out the device, and you'll put your arm above your head like this, and really it's not that bad. It's really not that bad. It can take a while if it embeds into the arm, but overall it was a pretty simple and easy process. And you should be in and out of the doctor's office within an hour. How does the Nexplanon work? Does it secrete hormones? How does it keep you from getting pregnant? It is a small rod that goes in your arm. It's about 1.6 inches, and it's like the size of a match. Very small in diameter, and you can feel it under the skin after the insertion. And what it does is it secretes a hormone called progestin. And that is the synthetic version of the natural hormone that our bodies produce called progesterone. Now, what this birth control does, it prevents you from getting pregnant through preventing you from ovulating. And so when you have this inserted into your arm, you will not release an egg for ovulation. And then another thing it does is it thickens the cervical mucus. And so during that time when you should be ovulating, it thickens the mucus to where the sperm can't get to the egg even if it wanted to. The Nexplanon is highly, highly effective. I've had 3 different ones placed. The first one for 3 years, the second one for 3 years, and this one that I just got removed, I had it for 4 years total. It was expired for a year. And I still did not get pregnant, even when it was expired, and we were not using protection, nothing else. So it is highly, highly effective. They say that it's a 0.05% chance of getting pregnant. It's an even lower chance of getting pregnant than when a man gets a vasectomy. That's like a 0.15% chance of getting pregnant. And so I'm pretty sure it's the most highly effective birth control they have out there at all on the market. And if I'm wrong, then let me know in the comments. Does the Nexplanon birth control or any hormonal birth control cause infertility? It does not. So they have done research and have shown that women with the Nexplanon who have had it removed, and then women who did not have the Nexplanon, so never had the Nexplanon, was not on any kind of hormonal birth control, both parties got pregnant within 6 months. And so once you remove this device, you can get pregnant right away. So within 1 week, you can become pregnant. Now, should you wait a full cycle before you start actively trying? Yes, absolutely, because it does take some time to flush these hormones out of your body. But they actually tested the blood to see if the hormones were still lingering around, and it was shown that within 1 week, those hormones were non-detectable in a woman's system. Does the Nexplanon cause weight gain? Yes. I think every single birth control, it doesn't matter what it is, anything that's messing with your hormones, and especially a birth control that's secreting progesterone or progestin, which is a synthetic version of progesterone, it's going to cause some type of weight gain. So in research, it showed that within 1 year, the average weight gain is 5 pounds. So that's really when you have to look deep within and kind of weigh the pros and cons and get your priorities straight, right? Because if you don't want to get pregnant, it's much better to maybe have 5 pounds of weight gain in a year and a little bit of water retention versus having an unwanted pregnancy. And then lifestyle changes, right? So maybe you should be like a little bit more careful if you get the Nexplanon, to just be aware that yes, it may cause a little bit of weight gain, it may mess with your hormones, and so maybe you just have to take, eating healthy and exercising and just considering your lifestyle a little more than before, when you could be a little more careless. Does the Nexplanon cause abnormal bleeding? For some women, it absolutely does, and some women actually have it removed because of that. It really just depends on your body. My personal experience is that it did not, it did cause abnormal bleeding, but not in a way that you would think. And so what happened for me is that the first year I had no period whatsoever. The second year I was having abnormal periods, so maybe a period every 3 months, and then 1 month I would have 2 periods, and I had like a little bit of spotting in between. And then by the third, am I saying month? I meant the first year, no period. Second year, abnormal periods. Then the third year is when I started to regulate, and then my body went back into like how it always was before I started birth control. And I was having regular periods, and so I was using the Flow app. I was tracking my periods, and every single cycle was like spot on. And so really, really regular and light periods the third year. And I also had this in an extra year, 4 years, and so that fourth year was the same way. Just super regular periods, sometimes 1 day of heavy bleeding, sometimes 4 days of light bleeding, but never more than 4 days of bleeding, and super regular periods. How long does it take to get pregnant after removing the Nexplanon? I personally don't know exactly how long it takes. I just took mine out, but I'll keep you guys updated. They say that it takes a week for you to flush those hormones out of your body. You can get pregnant on Nexplanon's site. It says within 7 days. Within 7 days, they said use a backup contraceptive because you can get pregnant. And some women said, I did a lot of research, they said they got pregnant within 3 months. Some women said a year, 6 months. So it really just depends on the woman. But you can get pregnant once these hormones are out of your system. And that can be within 1 week, or generally they say that women will ovulate within 3 to 4 weeks from taking the Nexplanon out. And so that's something to think about, that you could be ovulating 3 to 4 weeks after the removal of your Nexplanon, and you could get pregnant right away. What are the most common side effects of the Nexplanon, and why do women most commonly have it removed? We'll tackle the second question first. So the most common reason why women have it removed is because of abnormal bleeding. And so there are a lot of women who experience abnormal bleeding. I was so lucky that I was not one of them. I think that this birth control does work really well for women who don't have like super heavy periods. I think if you have a more heavy cycle, then you may have a higher chance of abnormal bleeding. After reading some of the research, the number one most common symptom that people have from Nexplanon is headache. And I will say that I do experience headaches, I do experience migraines, but this was happening even before I had the Nexplanon inserted, and so I don't necessarily know that it was caused by that. I was 15 when I started taking birth control, and so maybe my headaches are from birth control. I guess we'll find out now that I've taken this out, and we'll see if my headaches resolve. And I'm just going to read you some other symptoms that some women experience with the insertion of the Nexplanon, and that's inflammation of the vagina or vaginitis, of course, weight gain, which we already talked about, acne, breast pain, abdominal pain, sore throat, whitish yellow discharge from the vagina, flu-like symptoms, and dizziness. And then a lot of people experience irregular bleeding. It says that 34% of people said they had less frequent bleeding, and about 22% said their period went away completely, which was my case. The first year I had no period at all. And it says that some people find that their period gets lighter or goes away. From doing some research, I saw that some women were saying that they developed anxiety, they developed depression, they developed muscle aches and joint pain. Some women said that a lot of women actually said that they had absolutely no sex drive and very low libido. There were women saying that they just don't feel like themselves, and then within a month being off of the birth control, like they just felt like so much more in tune with their body and they felt like themselves again, which is really interesting because I think that when we alter our body as women with any kind of hormone, like it's going to cause an imbalance, and it doesn't matter how many years that we're on it. Obviously, the more natural, the better. And so not being on a birth control and not constantly putting hormones in your body is always going to be better for your body. And of course, you're going to feel more like yourself and more regulated and just like more in tune with yourself and with your emotions and with your body. But like with anything, like we have to weigh the pros and the cons of that. And obviously the pro of that is that if we're not ready to have a baby, then we need to be on some type of birth control if we're sexually active, because let's just be honest, like pulling out is not, it's not the answer. And I think as women, like we need to be more responsible and making sure that we're taking care of our bodies and that we're not bringing unwanted life into this world, because there's just too many kids who are born into families that are not wanted, and that it's just not fair. And I know there's always adoption and things like that, but we have a way of preventing this and just being responsible and taking responsibility for our actions. And unfortunately, like one of those things is that as young women who are sexually active, like we need to be on birth control unless there's another way. Or even with condoms, like it can break. That's how my mom got pregnant with me. The condom broke. She told me that. I know it's horrible, but it's like it happens. So I mean, I understand like birth control sucks. Like I don't want to be on it either. And like I'm so happy that I finally was able to remove my birth control. And but you know, we do have to think about the pros and the cons of birth control versus getting pregnant. Other very, very serious side effects of the Nexplanon are ectopic pregnancy and blood clots. And with ectopic pregnancy, it's where the egg and a sperm implant, usually like in the fallopian tube, and then it can start growing over time and it can end up bursting your fallopian tube and, you know, causing you to possibly have that fallopian tube or ovary removed, which can decrease fertility. I will tell you that I have had the Nexplanon in my body for basically 10 years, and I have experienced minimal side effects. I mean, overall, I wouldn't have kept getting it. You know, I had the first one for 3 years, had it removed, had it replaced, and I wouldn't have continued having it replaced if I had such serious side effects that, you know, I was concerned. And I've tried so many different birth controls. I've been on the pill, I've been on the NuvaRing, I've gotten the Depo shot, I actually had the IUD inserted, and I've also had, of course, the Nexplanon, and by far the Nexplanon has been my favorite out of all of the birth controls. And I've pretty much tried it all besides the patch. I think the patch is just about the only thing that I haven't tried. So after trying like a million different birth controls, and I will say I don't know if I said that in this video or if it was in another video, but I've been on birth control since I was 15 years old. So, and now I'm 32. So after being on birth control for over 15 years, and having my Nexplanon removed, let's see how long it takes me to get pregnant. I'm definitely going to wait a full cycle and, you know, not try to get pregnant at all for at least a month, and then we'll see what happens after that. So if you want to follow along on my journey, then just hit that subscribe button If you can, I would appreciate it so much if you like this video, and I always love connecting with you guys. I answer all of my comments, and so please, if you have anything to share, if this video was relatable to you in any way, or if you want to share your personal experience with birth control or anything regarding like any of these topics, especially if you're in your 30s trying to get pregnant, or if you have an experience where you got pregnant, how long did it take you to get pregnant after your Nexplanon removal or after discontinuing any birth control that you are on? If you want to connect on socials, all of my links are below. I'm on all of the platforms. I would love to hear from you. I would love to connect with you. So please get on and give me a follow. All right, guys. I hope you enjoyed this video, and I will see you in the next video. Bye.